Oxistat Cream, also known as Oxiconazole, is a medication used to treat skin infections such as athlete's foot, jock itch, and ringworm. It is also used to treat a skin condition known as pityriasis, tinea versicolor, a fungal infection that causes a lightening or darkening of the skin of the neck, chest, arms, or legs. Oxistat Cream is an azole antifungal that works by preventing the growth of fungus. For best results, apply a thin layer of Oxistat Cream to the affected area once or twice daily, or as directed by your doctor. It is important to continue using this medication for the full prescribed length of time, even if symptoms improve before the infection is completely cleared. If you have any questions or concerns about the use of Oxistat Cream, be sure to consult with your healthcare provider. When using Oxistat Cream, make sure to only apply it to the skin. Clean and dry the affected area before applying the cream, and follow the instructions given by your doctor, usually once or twice a day. The dosage and length of treatment will depend on the type of infection being treated, so it's important to not apply the cream more often than prescribed. Be sure to apply enough cream to cover the affected area and some of the surrounding skin. If using the lotion, shake the bottle well before applying and use cotton balls or a soft cloth. After applying, remember to wash your hands and do not wrap, cover, or bandage the area unless directed by your doctor. Avoid applying Oxistat Cream in the eyes, nose, mouth, or vagina. It's important to use this medication regularly at the same time each day to get the most benefit from it. Continue using the medication until the full prescribed amount is finished, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. If your condition lasts after 2 to 4 weeks of treatment or gets worse at any time, be sure to inform your doctor. When using Oxistat Cream, you may experience some side effects such as burning, stinging, swelling, irritation, redness, pimple-like bumps, tenderness, or flaking of the treated skin. If any of these effects persist or worsen, it's important to consult your doctor or pharmacist. It's essential to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, if you do experience blistering, oozing, or open sores, it's important to notify your doctor immediately. Additionally, while a serious allergic reaction is rare, seek medical assistance right away if you notice any symptoms such as rash, itching/swelling, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects not mentioned, it's crucial to contact your doctor or pharmacist. Before using Oxistat Cream, make sure to inform your doctor or pharmacist if you have any allergies to Oxiconazole or other azole antifungals. It's important to discuss your medical history and all the products you use, including prescription drugs, non-prescription drugs, and herbal products, with your doctor or pharmacist before using this medication. If you are pregnant, only use this medication when clearly needed and discuss the risks and benefits with your doctor. It's also important to consult your doctor before using this medication if you are breastfeeding, as it can pass into breast milk. It's important to be aware of potential drug interactions with Oxistat Cream, as they may change how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Oxistat Cream. Always follow your doctor's instructions and consult them if you have any concerns about using this medication. If this medication is swallowed, it can be harmful. If someone takes too much and experiences severe symptoms such as passing out or difficulty breathing, it's important to call for emergency help immediately. In the U.S., you can reach out to your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important to remember not to share this medication with anyone else. This medication is specifically prescribed for your current condition, so it should not be saved for later use, unless your doctor advises you to. If you're using this medication to treat pityriasis, it's important to note that it may not immediately return your skin to its normal color. It could take several months after completing the treatment for your natural skin color to fully return. If you forget to use Oxistat cream at the scheduled time, use it as soon as you remember. If it's almost time for your next dose, then skip the missed dose and continue with your regular dosing schedule. Do not apply a double dose to make up for the missed one. Make sure to store Oxistat cream at room temperature and keep it away from children and pets. Do not flush it down the toilet or pour it into a drain unless instructed to do so. When the cream is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.